It's Russ Curtis, Professor of Counseling. Thanks for joining me today. I want to continue with our series on OCD. And we talked last about common aggressive thoughts that people who have OCD can experience. We also want to look at one of the next categories, which is common sexual obsessions in OCD. It's going to be important to remember, if I don't say it enough, that we're talking about obsessions and obsessive thoughts about this, not just passing thoughts. It's maybe important also to remember that thoughts are just thoughts. That doesn't mean we're going to act upon them. And that's actually an important treatment modality for OCD as well. And also, this is a very treatable illness, typically with a combination of medication and psychotherapy. Another thing to consider is, I forget the name of it. I believe it's PANS, but sometimes an antibiotic in children can cause kind of a sudden onset of different types of compulsions and obsessions. So that's another thing to think about, is if you've had an antibiotic. I don't know the details on that one, so be sure to check that out. And I will explain the part on the right later because I want to talk more about treatment, and that ugly looking graph is actually a part of what could be helpful for treatment. Okay, so some of the common sexual obsessions, overall kind of forbidden or perverse obsessive thoughts, images or impulses that would not be acted upon. Okay. Now, the problem with the obsession is the person will have the fear that they could be acted on. So that's when they develop compulsions to alleviate the obsessions. And what we're wanting to make people aware of is that thoughts are just thoughts, and there's more to us than just our thoughts. And so we'll talk about that later. Some of the other obsessive thoughts, and it's important to keep the word obsessive here, not just passive thoughts, but sex with children, animals, doubt about your sexual identity. Clearly, that would be obsessive doubt because people throughout their life might have doubt about that. Again, that's what we're talking about with passive thoughts. Incest, acting sexually towards others, obsessions with sex with celebrities, clergy, or strangers. If that one seemed a little offbeat, it's because I took these from one of the common assessment instruments. There's an obsessive compulsive checklist. There's also the Y box, which is, oh my gosh, sorry, I'm not going to be able to get that, but it's one of the more common public domain OCD assessments. I believe it's Yale Brown Obsessive Compulsive Checklist, something like that. All right, so on the right, treatment. A big part of treatment is normalizing. That's why I'm creating these videos. So folks, if you're a behavioral health professional, know that it is expected that clients who experience this will go 10 years before they actually report it. So they're essentially suffering with obsessions with this treatable illness before mentioning it, even if you have a thorough intake. So I would recommend having some brief questionnaire about obsessions so that you make people aware that, hey, we need to talk about this, and this can be treated. So this graph on the right is to say, hey, let's imagine your total self, okay, the you with the capital Y. You may experience OCD, but there's much more to you than that. You've got your education, career, relationships, dreams, interests, goals, all that other kind of stuff. So what we're trying to do is help normalize and also recognize that, wow, your obsessions may be taking a lot of time and also may be causing a lot of distress, but there's more to you than that. So that's the purpose of this graph. The other part is from a cognitive restructuring perspective, from cognitive behavioral therapy. Because what can happen is the person's thought about themselves is, if I'm having this obsessive thought, then there must be something flawed with me. And what we want to say is, no, thoughts are just thoughts. And you are more than your obsessions. And so that's a part of the restructure, okay? So we're moving from, if you will, there must be something wrong with me, to, oh no, OCD is problematic, it's causing me distress, but there's more to me than that, because thoughts are just thoughts. Doesn't mean I'm going to act upon them. All right, so I'm hoping that's helpful. Again, very treatable illness with a combination of medication and psychotherapy. And please share this with behavioral health providers, because I don't think it's being asked about enough, particularly at intake. And man, nobody should ever have to suffer for 10 years with something like this when it can be brought to their awareness that it's a treatable illness. Let me know your thoughts on these thoughts, and we'll talk to you on the next video. Take good care.